When you hear the word sarcoma, what do you think it means? A virus? Bacteria? When a growth of cells form in one connective tissue and become cancerous, it is classified as a sarcoma. What makes it different from other cancers is that it attacks the cells in the bones or connective tissue, which includes fat, muscle, blood cells, nerves, deep skin tissue, and cartilage. These tumors can be treated in different ways: surgery, radiation, or chemotherapy. Some types of sarcoma are Osteosarcoma, Chrondrosarcoma, Fibrosarcoma, and Liposarcoma. Let's look at each one separately and learn more about them. Osteosarcoma is the most common type of bone cancer. It is unknown what causes it. Those who are at risk for osteosarcoma are young males. Symptoms are swelling over a bone or bony part of a body, pain in a bone or joint, or a bone that breaks for no reason. Treatment is chemotherapy, then possibly surgery.
The way someone presents is it will be just out of the ordinary. They would fall and break something, and a break from a bone that should not have happened, because the tumor has been in the bone and has weakened the bone. So as they stumble and trip, which normally would just be a bruise, they end up with a break. Then they go to the hospital and they find that they've got a broken leg with an odd circumstance that occurred. And then upon x-ray, the bone cancer or osteosarcoma is found.
Chrondrosarcoma targets the cartilage cells in hips, pelvis, leg, arm, or shoulders. The causes for this sarcoma is also unknown. It occurs most often in people between ages 40 and 70 years old. Symptoms are swelling in areas and a broken bone at the cancerous site. Treatment is surgery, which could mean amputation.
It's a cartilage type of malignancy, so it's not in the bone, it's in the cartilage. And again, the same sort of presentation would happen where someone would have a tear or a break in the cartilage that would not normally occur by their method of injury, and then it's found to be the issue is actually a malignant tumor.
Fibrosarcoma targets the fibrous tissue of the bone. The causes for this sarcoma is unknown. It targets males in the 30s and 40s. Symptoms are pain and swelling of the cancerous site. Treatments to cure this are chemotherapy, radiation, and surgery.
A fibrosarcoma is of the fibrous tissue, even more unique. It is rarer, obviously, than those other two. Though the fibrous tissue connects all parts of our body, there are some places where it occurs more, these malignancies occur more frequently, and that would be in the lower limbs.
Liposarcoma eats away at the fatty tissue. The causes of this disease is still unknown. Adults 40 and above usually are diagnosed. Symptoms are visible tumors. Treatment for liposarcoma is surgery.
There's some things that we can do to control our chances of getting cancer, and then there's sometimes that just cancer happens. But there are a handful of things that we can do to control our chances of getting cancer, and that is to decrease our exposure to carcinogens. So good exercise, decreasing stress, just good healthy checkups, knowing what your body does on a regular day, and then making sure that you investigate why it's doing something different.